Tendinosis, a close examination of this condition's pathophysiology, clinical features, and its relationship with the ICF model. Tendinosis, osis meaning cellular death, is an intratendinous degeneration that occurs over a longer period of time. It is a non-inflammatory condition resulting from a loss of collagen continuity and tendon overuse. Something as simple as performing the same repetitive motion with your hands on a computer can cause tendinosis. Tendinosis is chronic and causes damage to the tendon progressively. This next slide includes a video which helps to explain the rotator cuff muscles and the ways in which they can be affected by tendinopathies.
The rotator cuff comprises a set of 4 muscles that serve to stabilize the shoulder, including the infraspinatus, supraspinatus, teres minor, and subscapularis. They connect the scapula to the humerus. The tendons of these muscles may become torn where they attached onto the humerus bone due to impact or excessive stress on the shoulder, leading to pain and limited mobility of the region.
Tendinosis often gets grouped in with impingement conditions. However, it is important to understand that the two are distinctly different. Tendinosis is the deterioration of a tendon without inflammation, while impingement refers to pain caused by an inflamed bursa or tendon that pinches underneath the acromion as the humeral head is elevated. If you were to do a quick Google search and look up this condition, you will find that tendinosis also often gets grouped in with the umbrella term tendinopathy, without much distinction. However, as stated, tendinopathy is an umbrella term for various conditions occurring on or within the tendon, and that does not account for the unique characteristics of tendinosis. In the case study provided, TD is a 45-year-old hairstylist presenting shoulder pain in his right shoulder. The shoulder pain has been ongoing for months, however, was left untreated during this time. After an evaluation, TD was diagnosed with right rotator cuff tendinosis. TD's work modification and therapy compliance is noted as poor. It is observed that he has atrophy of the right shoulder girdle muscles and range of motion in his shoulder is limited and painful. Now we're going to go ahead and explore the pathophysiology of tendinosis. A tendon is dense regular connective tissue made up of bundles of collagen and connects muscle to bone. Tendon tissue transmits contractile forces to bone to generate joint movement. Tendons are more elastic at low strain rates and stiffer at higher rates of tensile loading. Based on the composition of a tendon, being that it is densely packed collagen fibers that are neatly lined up, it is intended to withstand heavy forces and is quite adaptive to loading. So what exactly happens when a tendon gets overloaded? Due to the arrangement of collagen fibers when tendinosis is present, the collagen fibers are not aligned and unable to facilitate load bearing. As a result, there is a reduction in the strength of the muscle and the bulk of the tendon increases, and this contributes to injury. Tendon will begin to show signs of mechanical damage when excessive overloading or repetitive loading persists. Tendocytes will also take on an abnormal shape when this is happening. As stated earlier, tendinosis is a chronic degenerative condition. When examining tendinosis on a pathological level, what are some things that will be noticed? Well, there will be a loss of collagen continuity, focal necrosis, an increase in ground substance vascularity, increased cellularity of fibrocytes, and increased roundness of the nucleus of the fibrocyte, and increased levels of lactate and glutamate. A microscopic view of tendinosis will reveal a large number of type 3 collagen fibers, unlike a healthy tendon which has an abundance of type 1 fibers. When examining an abnormal tendon under a microscope, inflammatory cells are not present. Abnormal tissue of a tendon appears dull, brown, and soft. Normal tissue of a tendon appears white, glistening, and firm. Thickening of the tendon may also be present, which is how the tendon attempts to heal itself. So essentially, the tendon is changing at a structural level when tendinosis is occurring. These degenerative changes typically affect the medial aspect of the tendon, especially the Achilles tendon. This slide illustrates and explains the structure of a normal tendon versus the disorganized structure of a tendinosis lesion. Clinical features of tendinosis are most often occurring in the Achilles, the patella, the supraspinatus, and lateral elbow common extensor tendons. Common locations for tendinosis include the rotator cuff, the common right wrist extensor, the patella, and the Achilles insertion. Pain in the shoulder is typically exacerbated by resisted movement. It is often associated with pain and weakness during external rotation and elevation. Additionally, there is a loss of flexibility and range of motion in the shoulder joint.
Clinical features specific to our case study: decreased range of motion, weakness on affected side, pain at shoulder, inability to perform osteokinematic movements, and minimal inflammation. Just to note, minimal inflammation was not mentioned in the case, but we could assume that from our research that the buildup of these disorganized tendons and fats were too much, and the condition obviously is tendinosis, which is known for minimal swelling as a feature or minimal inflammation. Activity limitations, such as overhead movements, for example, reaching for things in the cupboards. This is limited due to the active range of motion being only at 50%. Another limitation would be lifting, unable to elevate arm past 90 degrees, and strength wasn't even conducted due to the pain. So this could be lifting groceries. This is limited due to the strength and inability to lift the arm past 90 degrees. Activities of daily living will be limited: bathing, combing hair, dressing. Leisure, riding motorcycles, obviously your shoulders must be in flexion, which is unable to perform. Employment, obviously hairstylists also have to perform shoulder flexion, constant shoulder flexion, and obviously his range of motion was listed at 50%, which limits his ability to perform these activities. Participation restrictions such as occupation, shoulder flexion pain can restrict the participation in hairstyling. Activities of daily living such as bathing, combing hair, dressing is also limited or is restricted because of the range of motion and decreased strength. Social interaction, say the community of motorcyclists, friends from there, friends, family. This pain is restricting these interactions. Leisure activities, riding motorcycles, obviously shoulder flexion is needed, which is limited and obviously is a restriction. And productivities such as cleaning his living area or his motorcycles, or even being able to lift up groceries. So an MRI analysis. So when examining an abnormal tendon after an MRI, inflammatory cells are not present because this is tendinosis, not tendinitis. So abnormal tissue of the tendon appears dull, brown, and soft. And in contrast, a normal tissue of a tendon would appear white, glistening, and firm. Tendopathy is most common or near the bony insertion, which in our case is the humerus. And obviously, this is due to the overuse or repetitive overhead movements causing the micro tears leading to tendinosis.